Hey everyone. I'm not exactly very happy with the methodology of my topic, so if anyone could give me some constructive feedback on that or anything else really, that would be awesome. The title of my research proposal is Successful Treatment Methods for Low-Income Mothers with Symptoms of Major Depressive Disorder. So my research question is, what are treatment methods that former MSW interns have deemed successful in treating low-income mothers who are showing 3 or more symptoms of major depressive disorder? Successful is defined here as alleviating all symptoms of major depressive disorder in these low-income mothers. This research is important because it will increase knowledge of successful treatment methods that have alleviated all symptoms of major depressive disorder in low-income mothers who are showing at least 3 symptoms of major depressive disorder. With this knowledge that we can find from this research study, social workers can improve services, especially since social workers tend to work with low-income individuals and/or families. Current research in treating major depressive disorder has found that antidepressants and psychotherapy, such as cognitive behavioral therapy and interpersonal psychotherapy, the combination of antidepressants and therapy, are effective in treating major depressive disorder. Actually, is effective. However, the samples used in past research studies are usually predominantly white or of a higher SES. For example, one of the studies that I found said that a huge research study that we rely on when thinking of treatment methods for major depressive disorder, that the sample they used in that study was actually 40% college graduates. So I found 2 studies that researches treatment methods for treating low-income women and mothers who have major depressive disorder. In one study by Miranda et al., they found that more women remained engaged for a longer duration in treatment when taking medication. Outcome gains were also more extensive when taking medication. A mix of antidepressants and psychotherapy proved effective in reducing depression symptoms, just like previous literature has noted. But it did also find that case management strategies are needed to engage low-income minority individuals in treatment, which I definitely agree with. I think case management kind of does an all-around. I mean, you do need to get the psychotherapy in there, but and of course antidepressants are important too, especially if it's diagnosed with major depressive disorder. But case management kind of makes sure we get an all-around wraparound service kind of thing. At least I would think so. Another research study that I found by Rojas et al. Found that intervention in the form of a psychoeducational group, treatment adherence support, and pharmacotherapy was much more effective in treating postnatal depression in low-income mothers than intervention in the form of antidepressant drugs, brief psychotherapy, medical consultations, and external referrals for specialty treatment. So I would say, I guess, some type more extensive psychotherapy, maybe in the form of a group, with also kind of case management and therapy on whatever medication you're taking is better than just taking the medication and having brief psychotherapy and some doctor's appointments. So just more extensive and in-depth. So my proposed methodology is the researcher will gain access to 30 former MSW interns' emails through the permission of an agency that serves predominantly low-income mothers. Researcher will send the former MSW interns an email with an attachment of an adult consent form and a cover letter introducing herself, describing the research project, and inviting them to sign the attached adult consent form and to take up to 30 minutes to answer an anonymous web-based survey. I project about 10 out of 30 former MSW interns will participate. So my survey, so I'm hoping to reach out to interns who have been obviously done clinical therapy work in their past agencies and have worked with low-income mothers and have worked with people who have clients who have symptoms of major depressive disorder. I'm going to ask like 1 or 2 questions that are super open-ended, kind of evaluate all the answers and see if there's any overlap and use that data to come up with some results. And I have some examples there. So any feedback would be great. Thanks, guys.